Dr. Sutton here, now answering some of your questions. First question, Dr. Sutton, is intermittent fasting safe for seniors?
Yeah, so what is intermittent fasting first? It's basically taking breaks between the day where you have periods of voluntary fasting, and the American Heart Association has found benefits in it. They've shown that it's associated with reductions in weight, as well as reductions in the risk of diabetes, high blood pressure, even heart disease. But it's important to know that if you're older, it does come with more risks, specifically for those patients who are taking medications. For example, if you're taking insulin, periods of fasting can be quite dangerous and lead you to having low sugar levels and be a medical emergency. So I always advise, make sure you talk to your provider before you make decisions about fasting.
No, that's really smart. All right, next question is, what's the difference in stages between sepsis and septic shock?
So I always get this question. Many people use the word sepsis interchangeably, and I think I just want to provide some clarity. So sepsis is when your body is responding to an infection, and symptoms can include confusion, elevated heart rate, low blood pressure, and a fever. And as ER doctors, our job is to basically investigate and play detective. Where is it coming from? Is it a pneumonia? Is it a urinary tract infection? It is a bone infection. Patients who are not treated appropriately for sepsis can progress into septic shock, which can lead to organ failure and even increase the risk of death. And so it's really about the terminology that we use, and again, it's about what causes the sepsis.
All right, and then your prescription for wellness today.
With the current heat, it's really about paying attention to the heat wave and making sure that you're protecting yourself from the sun and staying hydrated. So I've got some tips here. Number one, drink water. The average man needs about 3 to 4 liters a day. The average woman about 2 to 3. Many people underestimate that and unfortunately don't drink enough. And 20% of that does come from food, but the rest comes from what we drink. Some tips to keep up with that is eating hydrating foods such as cucumbers and watermelon, as well as pineapple and celery, and also avoiding the peak heat times and paying attention to that heat index. Humidity is a factor that doesn't allow us to escape heat, and it can increase our risk. And so paying attention to that heat index, and if it's above 90, you have to practice extreme caution, and then minding yourself inside of your home and making sure that you keep cool. Closing your blinds and closing doors to unused rooms can keep cool, especially when you're using that air conditioner. So hopefully people can use these tips to stay cool, stay hydrated, and protect themselves from the heat.
Yeah, very important right now across much of the country.
Absolutely. It's incredibly hot outside.
It is. All right, Dr. Sutton, we're going to let everyone know you can send your health and wellness questions to ABC GMA3.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.